Hello, everyone. My name is Tim Mikhelashvili, CEO and co-founder of Amedea Pharma, also host of Medical Innovation Olympics, a fourth annual global, fully virtual ideation competition that has a very unique sports Olympics format. Okay. Today, I am joined by our expert judges, former competitors as well, Chris Piedmonte, John Hemming, as well as Irtaza. Hi there. And the goal of this session today, as we're live on 4 different platforms, including Instagram for the first time, LinkedIn, Instagram, Facebook, and YouTube, is really to explain to all of you what makes this particular format of competition exciting and why more of you champions in healthcare need to join this event. Okay, so this is a call for competitors. We're going to discuss those reasons here. Please let's introduce ourselves to our audience who's interested, who's probably heard about this event, and the goal is to get more people to know about this event, with this session. So who would like to start? Chris, maybe I see you nodding.
I'm happy to start. So I'm Chris Piedmont. I'm the managing director of Neoterra Capital. We're a firm that invests in very early stage companies, many of them in the medical space. That can include products, and we'll talk about some of those later today with some of the competitors, as well as services. So we've been at this for a number of years now. I've been participating in the Olympics for, I think it's been 2 years now, and I'm looking forward to this year.
Likewise, we're looking forward to having you. Irtaza, go ahead.
Please. Yeah, hey everyone, my name is Irtaza. Quick background, I'm a 2-time operator, 2 successful exits, spent about a year working in tech transfer and new venture development, and currently I'm at OMX Ventures. We invest in early stage therapeutics and platform companies.
Okay, wonderful. And John?
My background's a mixture of various things. I've been in tech. Since I was 23, I set up my first business, which was a computer business. That was over 40 years ago. And I've been in politics. I spent 18 years as a member of Birmingham City Council and 10 years as a member of the UK Parliament. I'm a jazz musician. In fact, I played a gig last weekend. I'm playing a gig on Saturday. And I head up the biohacking team, which has recently entered a new contest, which is the ALS Longitude Prize, which is, I suppose, similar in a sense to the Olympics, the Medical Olympics, on the basis that you're competing with ideas. And we're obviously with the ALS Prize, the Longitude Prize, that's about solving ALS, which is a complex issue, which I think I've solved. But if you've got a new idea, an opportunity to promote your new idea is the Medical Innovation Olympics. It's a unique opportunity, in fact, because there's nothing that just has such a broad, if you've got, it's basically any good idea within the context of medical affairs. And it was useful to us last year as a mechanism of putting forward your idea, discussing your idea. You get some challenge, but that's useful, and promoting your idea.
Yeah. You've done a lot of amazing research in the field of longevity, John. Last year, you were a competitor, and I'm so glad to see that you're now on the board, helping us grow this this event.
Well, it's useful to encourage people. That's the thing. I'm very happy to do this. I don't get paid to do this. I won't get a prize because I can't enter. But I wish to encourage people to think up good ideas, to work on new projects. New projects are where the world develops.
Yeah, absolutely. Let's share a little bit of the requirements in this festival of ideas, since we are looking for some of the best concepts and products, but ones that have been initiated since October of last year. We usually hold this event in the fall. We're partnering for the first time this year with New York Bio, a global innovation incubator here in New York, NYU Langone. Here are our expert judges, some of whom you see here, leaders in medical affairs, in healthcare and R&D, manufacturing, researchers, investors as well. Les Funteleiter will join Chris and Irtaza as another investor, and maybe more as well. Okay. Many of them will speak as well. Sandra Walker, Natasha Hansji from Roche. Here are the 6 innovation tracks that we will be receiving our concepts and products in: drugs, devices, diagnostics, and med tech. So in these 4 categories, we've already been receiving some amazing, incredible submissions. Also in marketing and medical affairs, where we're not getting as many. So this is one of the other reasons why you'll be hearing more about this event through weekly LinkedIn lives and live streams. So we're looking forward to different types of innovation from various angles of healthcare. If you are a current employee, consultant, a student, or a fellow, and you have your own vision or a product that you may or may not be already sharing, or you may be hesitating to share it somewhere, this is the venue, the platform, which will allow you to not only present it, but iterate it over 16 days of competition, similar to the 16 days of glory in the Olympics, if you remember those famous videos in the Olympics. Okay, so we're looking for ideas across these 6 innovation tracks. So this is a particular call to all of those in the drugs, devices, diagnostics, but also, again, marketing, medical affairs as well. Here are our current front runners. Okay, so our 6 leaders who already participated in round 1, session 1, that concluded in June 6th. Connor Lloyd, David Mead, Brett Quigley, Gena Nikitin, Chris Adams, and Archil Jaliashvili from all over the globe. We've been evaluating them through our expert judges. They received their votes in real time as well. So this is a type of competition where you know the kinds of votes you're receiving, why, immediately. This is not somewhere where you have kind of a decision that's made later down the road, and you don't know what the parameters are and what the feedback really is, right, for what particular attributes of those ideas. Okay, and that's where the sports, kind of the Olympics kind of format comes in. We always have an Olympian as well, kick off the games as well as close them. So we'll have Chris Cook and others as well. More surprises to come. Chris Cook is a 2-time British swimmer, Olympian, speaker, NHS UK advisor as well. And so some of you, if you advance far enough, you may actually have a chance to present in front of not only the expert judges, but also an Olympians as well. So that's a little bit about the format. And now, just so that you have an overall view, okay, there's going to be an opening ceremony October 6th. Okay, so once we finish with our 2 Olympic trial sessions and others who will register, and by the way, early bird pricing ends July 31st, we'll have an opening ceremony where you'll all introduce yourselves, competitors. There'll be a lot of learning. Some of the expert judges will be speaking. We'll have expert panels on a lot of the global topics that the industry is facing today. Every week, you'll have 10-minute presentations that you will be able to set up. Okay. They'll be live, but also recorded on demand. So the judges will vote based on those 10-minute presentations. Every competitor has 1 presentation per week. And there are 2 rounds of elimination. So this is done asynchronously. And then those who advance based on the votes will then present live once again in semifinals and finals. There's 2 prizes for the best product and concept, $5,000 each, sponsored by Amedea Pharma. All right, so that's the format. What are some questions that you have? Please let us know after you watch this live stream or now as well. But what questions or what kinds of other suggestions do you have for our entrepreneurs? Chris, Irtaza, what are you particularly excited about? Maybe some kind of topics or currently in healthcare innovation.
Yeah, let me take that on because we are doing a number of things in that area. So first of all, from my perspective at Neoterra, we look for real innovation. We generally look for companies and groups that are doing something that has some element of some novel new innovation in it. It can be in terms of a new procedure for getting things done. It can be in terms of a new discovery on how to ascertain, effectiveness of drugs, like some of our competitors are doing. It can be in using new materials to create, products for people. Brett Quigley, for example, at Tarka, is using some new and innovative materials to create better seating for wheelchairs. That type of innovation is really what I look for, and it's one of the reasons I get excited about these Olympics. Is we get the opportunity to see companies like that and even individuals. For example, John previously and his work in longevity was very interesting. And we get to hear about those ideas. We get to figure out, which ones have merit. The ones that do, quite frankly, in many cases, I will try to help either through introductions and in some cases appropriately capital to help advance these ideas. So, my participation here and the advice I have for anyone who's interested in this, if you have something that is new and novel, even if it's just a concept, competing in this event will get you exposure. You'll get to present your ideas to not only the judges, but all of those participating and everyone that's viewing. That type of platform, that ability to get in front of these people, can result in relationships and eventually help that you may not get any other way. So I'd strongly encourage anyone who's working in the area of new drug discovery, new techniques, and going further into medical affairs and marketing and management, that if you have some innovative ideas that you think are worthwhile or just want to explore, join us and participate.
Yeah. Thank you. Yeah. I was very impressed with Tarka and all the other competitors. Yeah, absolutely. I can't wait to see what we have in store in the second session and the main final. Yeah, Irtaza, I think you went off of mute there.
Yeah, for sure. Happy to just contribute my thoughts. I will plus one everything Chris said. I think, as probably most of the competitors know, we are like this. This is a very tough fundraising environment. Capital is not readily available for new innovations. That said, I think that means that it becomes even more critical to differentiate yourself. And the way I think about differentiation is you can have 0 to 1 innovation and 1 to 10 innovation. And what I mean by 0 to 1 innovation is these are the things that are novel methodologies, something that's very new, unique, that hasn't really been tested before. And then there's the 1 to 10 type of innovation, which is taking something that already exists and a modality that already exists and perfecting it. And both types of innovations are really, really, really critical. But I would say right now, the things that, if you're early stage, you really, really need to have something strong in that 0 to 1 stage to really get funded, which is why I think platforms like this are really, really important, right? Having a space where you can continue to pitch and continue to get in front of people that are investors, that can give you critical feedback on what you're doing and really, really help you hone in on getting your value proposition, your pitch to be strong. Also, this is a really great place for us to be able to connect you to other people, right? there's, again, I think in our field, experience is really, really critical. The more experience you have on your board, your advisory board, your management team, the more and more likely you are to get funded. So hopefully we can be helpful in that as well, connecting you to other team members and advisors. So it's tough out there, but that's what we're here for, is creating an environment where we can help each other succeed.
Yeah.
Let me add a little bit more to that too, because there's been a change in some of the things that people need to consider. Previously, through programs at NIH, National Science Foundation, and others, it was possible to get grant money throughout the small business innovative research programs or other programs available. For now, many of those programs are still in place. However, they are in question going forward. This may also make it more difficult to find funding, particularly at the research and development stage. All the more reason to participate in this event. It will get you in front of people that are interested in companies at that stage, that do have resources and connections and the ability to make introductions and to help, foster your ideas and your work to get them to the point where they are commercializable. So once again, now more than ever, I think the medical Olympics are going to contribute significantly to the success of some of these companies due to these changes in government policy.
Yeah, absolutely. And even if you do not end up winning the prize, let's say, or advancing far, this is a continuous debate and workshop, right? An Olympic village spirit where there are also recognitions for various different qualities of those ideas, right? You don't have to necessarily be a well-organized startup. If you may have a big idea and a concept, right, and you may be even a student, as I mentioned earlier, or an employee, right? We are also open to those concepts and to enhancing them. And that's actually what took place last year from one of our winners in the patient centricity category that we had, where every time they presented, Mark Armstrong, if you remember, Chris, they presented a new updated version of their presentation. They kept us at a surprise, always kept us guessing. And you saw how that idea evolved over time. So,
and I think that for him was specifically very helpful. I mean, many of the things he originally came with, how he was envisioning the product, how he was going to take it to market, the requirements for funding, timelines, all of that, over the various iterations over the time of the Olympics, when we were giving him, his scores and his opportunity to improve in those areas, he took very seriously and went off, in some cases, even consulted with some of us to, how do I improve in this area? What can I do to make this a more complete, understanding, compelling, whatever the shortcoming was, component of what I'm presenting. And, if you watch the recording from his first presentation and then his last presentation, the improvement is substantial. And all of that happened because of his participation in the Olympics.
Yeah. Now, those of you who may be watching this and may be thinking, wow, it's 16 days, it may take a long time. Do I have that time? Right. So let's address that a little bit, because the ceremony is a full day event, but you don't present there. You only introduce yourself during a specific dedicated allotted time. The first 2 weeks are really at your leisure, on demand, for both the judges and the competitors and attendees as well, or spectators, right? And so you have to schedule that time, and it's really built around your schedule, right? But the level of the community that we've built, the kinds of polls, the discussions we've had, and I can share them a little bit later, just visually as well, is really what adds to the experience that is different, the more deep networking type of experience, right? Where the investors also and the spectators get to know how competitors think. And even as an attendee or someone, let's say as a sponsor who's joining, you can, use this event to network in a very unique, kind of memorable, different setting, right? You can hire, you can interview, you can, find consultants as well. So yeah, that's a little bit of the kind of environment we have been creating, and we've been careful to maintain as well. Here are the criteria, because you alluded to this a little bit, Chris. So since I did mention there are two categories, main categories, right, in which you can win prizes: concepts and products. And so these are the five various criteria for concepts, right? Validity, predictability, right? To what extent is there a causality between the outcome that's desired and your idea? How original is it? How applicable is it, right? So these are the five criteria, okay? And because we receive submissions across different life cycles of the products as well, some of them are more mature. And we have a few examples of those this year as well already. An AI company, for example, for skin cancer. But in the product category, those who submit those corresponding proposals, we chose these 5 different types of criteria. Okay, solution, market, the team, performance, and the roadmap. The clarity of that, and just being able to address where the shortcomings may be, the weaknesses, the strengths, and actively searching to address them. To Irtaza's point earlier, right? It's the environment is tough out there, but you have to constantly get in front of the investors and know what to address. And these will be available to all of you competitors. Official rules document. Once you register, everything will be made available to you. In terms of the judging, since you are judges as well, and the criteria, how, if you were competitors then, right, and you're giving this new global competition a try this year, what do you need to focus on if you're a product or a concept? Are there any maybe tips you can provide to those watching this?
Yeah, I mean, I'd be happy to. The challenge, quite frankly, is always clarity and brevity.
Okay.
You know, many presentations turn into rambling, diatribes on their product or what they're doing, and without focus. That should be avoided. You need to get down to the essence of what you're doing, what it is, why it's important, and what your intentions are, and to get through that in a fairly succinct and clear manner. The other mistake I see is assumption of knowledge. In a lot of cases, particularly with technical products or highly advanced, medical terminology, sometimes people assume the audience has an understanding of the acronyms and the processes. They generally do, particularly here at this event, but sometimes they don't. So you need to give that some thought. And if you're going to make an assumption about whether or not someone is familiar with an acronym, for example, you may want to define the acronym once. If you're going to use a lot of TLAs, 3-letter acronyms, it helps to define it. So I would recommend that as well. Even if it's a one-time upfront definition when you first introduce it, helps. It helps. The other thing is particularly when you're pitching the concept of a venture, product or service, whatever you have, is certainly a major component of it, but it's not all of it. Understanding the market, what the capabilities of your team are, what alternatives do people have to what you're offering, and how is that going to present itself as competition to what you're doing? How do you defend what you do in the market? Do you have patents? Do you have trade secrets? Are there other barriers to entry that will keep others from emulating you and copying you? All of these things are important, particularly from my perspective as a potential investor. I'm not investing in your product or service. I'm investing in your company. Those things are very different, and understanding the differences between those two things is important when you're going to present an idea for a company.
If I can support everything Chris says, I think that the key is that you have an opportunity to do the presentation that you will have to do, presenting your ideas to other people, but you will get advice on how to improve that presentation as well, which from many people you won't get.
I'll plus one everything Chris said. I think for me, where I see startups going wrong a little bit is like when it comes to market, TAM, SAM, SOM. It generally, I mean, not generally. Like I think a lot of newer entrepreneurs will just pick the entire disease state or the entire industry and say like my market is like $500 billion, and that's like crazy. It's your market's not $500 billion. You're not going to capture $500 billion. I think it's like really important to figure out like who's actually going to use your product, what else exists out there, and like how much of that market can you realistically capture, and how much will those people be willing to pay, right? and sort of build your market from the bottom up. I think that's really, really critical. From an investor standpoint, that shows that you've got maturity of thought and you really understand what you're going after. That's one. I think the other thing, and this depends on how far along you are, but these days their IPO windows are generally shut, and so like your exit to pharma is really, really important, and that means getting conversations going, not too early, but also not too late with big pharma, and just understanding like who could be your potential acquirers. Are they actually interested in this technology? Maybe they've already got like 10 other products in the pipeline, and this just isn't something that's like interesting to them. So I think that's also a little bit important too, especially these days, to just get feedback early and get meaningful feedback from strategics as well.
Yeah, absolutely. I'm going to add a little bit more to that too. You know, in general, you're absolutely right about market. One of the challenges you can have in innovation, though, sometimes the market doesn't exist yet, and you're actually going to create a new market. That's difficult sometimes to figure out. You know, what is the potential market size? Existing markets, you know, as you described, you know, a top-down analysis. You know, what is the size of the total available market for what I'm offering? You know, how much of this is addressable by me for various reasons, and then how much can I actually obtain during the life of my company? All of those are important when you're going into an existing market that already has a solution and you're coming in with a better solution. This is your 1 to 10 type thing you talked about earlier. But if you have something truly novel, and we do see this a lot at Neoterra, the market doesn't exist yet. You have to create the market. Yeah, and we've seen that in many innovations, you know, over the decades. The market for internet technologies, the market for cellular communications. We're certainly seeing it now in the market for artificial intelligence. You know, these things will continue. So those are better off, and you know, as you described, as a bottom-up analysis, that if this exists, what market would it create? So knowing which category you're in and analyzing it that way is important. I absolutely agree with you on that. You also covered something I missed, which I also think is extremely important: exit strategy. How are you going to get the investors their return on their investment? You got to remember, they're giving you money because they're expecting you to take the money you receive from them, turn it into a lot more money, and give it back to them. That's why they're here, along with other reasons, of course, because some of us do like seeing certain things accomplished, and the money is a means to cause that to happen as well. But I do see presentations sometimes that don't address the investor exit. In other words, how do I get my money back out once I put it in? That's critical. And exit strategy. Am I doing a sale to a competitor or another company that could leverage what I've done? Is it a sale to a private equity firm that wants to take the company and continue to grow and expand it? IPOs, you know, interesting sometimes. I personally am not a fan. I've seen a lot of them go very badly for companies that initially tick up very nicely, and then by the time their lockup period is over for the you know, the employees and the founders, the stocks have deteriorated significantly. I do not like handing my future over to every kid with a Robinhood account. So I'm a much bigger fan of the private exits, because they're generally done with good reason, much more care, and quite frankly, result, I think, for the founders and the employees in a better outcome overall. But you do need to understand, how are you going to exit? What is the means by which you're going to return the value to, you know, to the early investor?
Yeah. And that's going to be particularly relevant probably for the product category entrance this year, correct?
Services as well. I mean, you know, no matter what's going on, an investor at some point is going to want the return on their investment, because they want to take that money, go find other innovative companies and you know, participate along with them. You know, those that invest early on versus those that invest later are very different people, very different organizations. They have different goals. They approach things differently. And when a company grows this size, where it is now profitable, it's generating revenue, it's sustainable on its own, the interest of the early investor really goes away. They want that next big innovative company, and they want their money back so they can go chase that. On the other hand, those that prefer the, you know, large successful organizations, the idea that they can pull dividends or profit sharing or otherwise extract, you know, value and hold it for a considerable period of time, sometimes decades, quite frankly, are much more interested in the companies at that point. And that transition is what gives you the opportunity to return capital to the early investor by selling the company to one of these later stage investors. And that's a lot. That's something, quite frankly, a lot of, especially new entrepreneurs, not only do they not understand it, sometimes they're not even aware that this is part of the process. Yeah. So it's certainly an important consideration when you're presenting an idea to someone that invests at my stage or OMX or any of the other early stage companies.
All right. Great. Thank you, Chris. Yeah. So we have the products and the concepts was the other category, of course. I do want to also, again, reiterate, which may or may not know that market very well, but they should research it based on the comments that we've heard here, and also potentially be very courageous enough to build that market as well. And one good example is probably longevity medicine. And we've had James Payer 2 years ago be our keynote speaker, PhD researcher himself, who was very instrumental in building that market of longevity and fund $400 million in longevity. And we know how that market is growing and aging tech. It's one interest that I have, and we're sure to have a presentation at 1 or 2 this year as well on that topic, right, John?
I'm sure there will be, but it's a big market. Yeah. It's everybody, isn't it?
Yeah. All right. So as we wrap up, I just want, again, to invite those who are watching this to join our community. And what do I mean by this community? Well, we already had a very strong track record of where our previous competitors have gone since the event, and I'm actually displaying them here. Okay. Some of our past competitors have been recognized by the White House for their public health accomplishments, implementing their medical grade wearables in the Dutch athletics team at Paris Olympics last year, a sports medicine company, and also professional Italian and US soccer teams, Oro Muscles, and they were a bronze medal winner. And that they were actually a company that was referred to me by Chris Piedmonte here. You know, he wasn't a judge at that time. He was watching. That was 2 years ago. But so just to give you an idea of where you can expect, to take your ideas and build your ideas after the event. We've had companies like Roche, Takeda, Astellas, Menarini Group as well present. Okay, and what I'll say is that we're using the Hoover platform as well. All right, which should be familiar to you. It's actually really easy to use. Okay, there's the experience that you'll see is a little bit very different. It'll certainly have an Olympic feel to it, and let me show you very quickly what I mean by that before we close. All right, so this is what you can expect. Okay, your ideas will be showcased here. All right, so each one of your ideas will have a dedicated page. So I mentioned the winner last year, one of our 2 winners. So they receive comments from judges here publicly. There's a lot of community polls, as I mentioned, and a lot of activity. All right, this is a platform that's used by many scientific conferences. We'll make sure to continue to have that engagement and to make sure that you receive the feedback continuously. So very excited. See you next week, Thursday at 12 p.m. Eastern time. And I thank my panelists and judges. Any final comments? I want to leave the last words to you guys.
Well, what I would say is anyone who's got a venture, who's got an idea, has to ask themselves why they should not participate in this. Because it's an opportunity, and you don't get many. There aren't other opportunities, so you have to have a really good reason not to participate.
Thank you.
Yeah, I would also add that even if you're not bringing an innovation, there's value in attending. You get exposed to all these new and innovative ideas. You potentially have the opportunity to help or collaborate on some of those if you're a service provider or have an interest in them. This isn't just for the judges and the competitors. There's an audience. There are spectators here as well, and they too will get value out of attending.
Yeah, great.
+1 to both you, John and Chris. There's nothing I can add to that. Come, attend. It'll be good for you if you are anywhere near this space.
Great. Thank you. Have a great afternoon, everyone. See you soon. I'll drop the comment in the comment. You'll see how you can register. I'll make sure to post the comment. Bye, everyone.
All right, take care, everybody.